with retinol, retin-A, any of those, I think consistency is more important than intensity. So people think they have to peel and scale. And I think if the people that use it, consistently have the best skin in their 80s.
Hi, skin friends. Thanks so much for tuning in to this week's episode of The Skin Reel. I am really excited to have my colleague, board certified dermatologist and Mohs surgeon, Dr. Shawna Flanagan, joining me. She has a private practice in Jupiter, Florida. And we met at a recent dermatology conference, and we were laughing because we both are the exact ages where a recent study showed that these are the peak periods where you notice a decline in your health, which is 44 and 60. So we had a good laugh about that because we were both at the same point, and it got us talking about aging and how we both want to age gracefully and what that really means. And I find that a lot of my patients want this as well. They want to look like themselves, but they also want to be the best version of themselves. They're not really trying to erase the clock and go back 20, 40, 60 years, but they want to look refreshed. They want to look vibrant. They want their outside to reflect how they feel on the inside. And we're going to be taking a deep dive into aging gracefully, how you can actually do that, and how focusing on prevention and maintenance can really help your skin in your 50s, 60s, 70s, 80s, and beyond. If you are interested in aging gracefully, you definitely want to check out this episode. Dr. Flanagan, thanks so much for being here. I'm so excited ever since we met up at our dermatology conference this fall to discuss aging, especially when you brought up that article that discussed the peaks of aging. So thank you so much for being here.
Thank you for having me. It was great meeting you at ASDS meeting.
So I introduced you briefly earlier, but I'd love for the audience just to hear who you are, what you do in your own words.
I am a board certified dermatologist, Mohs surgeon. I'm in Jupiter, Florida. I trained at University of Miami and opened my own office in 1998. We were discussing at the meeting how I'm at the top age where things go down and you're at the middle age where things go down. So I'm turning 60 soon and you're 44, correct?
Well, first of all, you look amazing. So you have to share your secrets. And yeah, it was an article. It wasn't Nature, but something similar to that title, but it was published in the Wall Street Journal. And they talked about how aging has these sort of two peaks where you see the most aging. Can you just talk briefly about that?
Yes, it actually wasn't that big of a study. It was only, I think, 107 people, but they followed them for quite a long time and they checked different things in their blood and different things with their bacteria and RNA. And instead of seeing that aging happens sort of in this downward spiral, there was kind of like this lull. And then there was this downturn at 44. And then you're kind of even, and there's another downturn at 60. They stopped studying people at age 70. So we're going to talk about what things we can do to sort of avoid those downturns.
Yeah, absolutely. I was a little surprised. I don't know what your thoughts are on this, that I was thinking that with menopause, the average age being around 51, I was thinking that there'd be more of a precipitous drop after that. So that surprised me a little bit. Did that surprise you at all?
That did surprise me a little bit, but there were men in this study too. So even the men had the same kind of age pattern without the estrogen drop. But we do know estrogen probably plays a part in our skin aging health.
Yeah, certainly the big plummet of collagen that can happen afterwards as well. So I feel like I hear this term a lot, and I even say it, right? That I want to age gracefully, but that doesn't mean that I'm just going to let everything just happen as it may and not do anything proactively to help that along, right? Do you feel like that's sort of your motto to age gracefully?
Yes, I want to be, the best version of myself I can be. So unfortunately, that doesn't start at 40 or 60. That kind of starts at 20, which a lot of girls don't realize. I didn't make it up, but someone said the best thing you can do in your 50s is wear your sunblock in your 20s. So you have to start protecting yourself because we know, and you're a Mohs surgeon too, we know the biggest thing is photo aging, which is the sun.
Yes, 100%. And we both do Mohs surgery, and I get this all the time from my patients who are in their 70s, 80s, 90s. They say, I wish I had known. I wish I knew. Back then they were told run around all day outside, minimal clothing, and there was no sunscreen, or they certainly weren't wearing it and protecting, and there weren't shade structures at the playground and things like that. So we've come a long way, and it really does break my heart when I see people who are younger at tanning beds or, frying their skin at the beach because I know what the future is going to look like for them. So sometimes I feel like a broken record always saying like sun protect and that photo aging is so powerful, but it really is.
So even starting in the 20s and 30s, I try to get people in my office kind of doing a laser, even if it's not an ablative laser, a few times a year, because I think, well, there's the study that shows even doing something like a non-ablative where we're not peeling off the skin, you have a less chance of getting skin cancer in the future if you do that a couple of times a year. And I think the younger people, if they invest in that, which, might be $500 a session, they're going to take better care of their skin. So we are preventing those 20 and 30-year-olds, even early 40-year-olds from getting skin cancer later. So I think that's a good anti-aging way to get them started.
Yeah, that's great. Like, you don't need to wait. And that's another thing is I feel like a lot of people wait until they want a lot of things fixed or changed. And that takes time. It takes a lot of money. It's not something that can be done overnight with no downtime. So I like to think of it as a little bit along the way, focus on preventative measures first, then what are some maintenance things you can do? And then you have some rejuvenative procedures that can happen as well. But yeah, starting as early as possible. Now, I feel like sometimes with the Sephora craze or what are they, Sephora babies and all that, like it's almost gone a little too far with the skincare craze and kids that are 16 don't need to worry about anti-aging products. But yeah, I love your point about in your 20s and 30s, start taking care of your skin because that's going to give you the best skin in your 50s and 60s.
Right. Which is a point you said they don't need that, but some of the people that have acne in their 20s, they're using retin A or topical vitamin A, which has been shown to increase something called TGF beta, which makes collagen grow. So I always think that's great if they just keep up with that because most people were used to using it for acne, or you can get the over the counter adapalene because you're doing something proactive, like you said. Even if the acne goes away, I'm like, no, keep using it. And I think with retinol, retin A, any of those, I think consistency is more important than intensity. So people think they have to peel and scale. And I think if the people that use it, consistently have the best skin in their 80s. So
That's a great point. And I mean, this seems crazy, but I have never had a laser on my face. I need to, right? Now that I'm at that peak. But what I have done is I had acne and I used tretinoin for my acne. And then in my 20s, I just continued it. I took breaks when I was pregnant and stuff like that, but I've consistently used it probably 25 years now. And to your point, like my skincare is really simple and basic. And if you don't want to do laser procedures, you don't have to. I really credit how my skin looks to A, sun protection, but secondly, just consistently using a tretinoin product for most of my life now. It can be simple if you don't have the funds or the time or don't want to necessarily do a lot of aesthetic procedures.
and I think that one we know is like a tried and true, builds your collagen, and probably helps prevent skin cancer along the way.
I hear this preventative Botox, and I'll share my thoughts, but I'd love to hear yours. Like, do you think that's something someone in their 20s should be doing to keep their skin looking great in their 50s?
When you're in your 20s, maybe you only need Botox once a year or every other year. But the same as what you said with lasers or not using retin A, once you get to a certain point, you're not doing sort of preventative maintenance. You're trying to dig your way out. So if someone comes in with like lines that are like there at rest, it's kind of like trying to iron a wrinkled shirt. It's going to take a lot of treatments as opposed to just kind of steaming it along the way. So my patients sometimes call it baby Botox or doing it I mean, obviously there's a time where it's like you don't need it, but
I think everyone's different, right? So it's not really just by age. And again, if you can prevent those muscles, especially here, from contracting, then you aren't going to get those deep etching lines. And some people just have very dynamic foreheads. I have a scar between my eyebrows, so my scowl lines are never that noticeable because of my scar. But I see people in their 20s who have a dummy smile, or they have, a lot of prominent wrinkles on their forehead. So everyone's a little different, but certainly, if you do have those lines or you're starting to see those lines staying after you no longer are raising your eyebrows or you're scowling, then that would be a time to think about, in my opinion, getting Botox or a neuromodulator to help prevent those lines from really becoming etched in.
because like you said, prevention is easier. An ounce of prevention is worth a pound of cure.
It's so much easier, it's less expensive. What about just skincare in general? What should someone in their 20s or 30s be doing? I mean, sunscreen, right? A tretinoin or adapalene. Anything else you think they should be doing?
I love a topical vitamin C or some sort of antioxidant, niacinamide, something like that under the sunblock because we know when the sun hits your skin, it releases all these things called free radicals or reactive oxygen species. And I sort of look at that not instead of sunblock, but the vitamin C acts sort of like a Pac-Man, just eats away the bad things so that sunblock can, because the sun could still go through the block. It's not like an end all be all, but I think an antioxidant is a good idea.
And also, if you have any sort of discoloration, that can be really helpful too. But yeah, I mean, your skincare can be really simple. It doesn't have to be super complicated. Any thoughts on like exfoliants, peels, things like that?
I mean, I like peels and they're not for everybody. I think if you have melasma or, like you said, pigment problems, they have a role. Personally, I have rosacea, so I've never been a big fan of peels, but you could do like a cleanser with salicylic because that's going to help, rosacea acne. Plus, it's sort of anti aging. And you could actually do like over the counter peels, exfoliants. But I do like people to shave their face, though. I think it's good.
Oh, really? I've never done this. How do you recommend it?
But there's just all these little tools to just take the fuzz off, and some of them are like ultrasonic electric shavers. I think it just gives you a nice exfoliate, especially if you're using Retin-A, you can get all the dead skin off. I mean, or you could pay and go to an esthetician and do dermaplaning, but I've been telling people for a long time, yes, it's good to shave your face.
Yeah, but maybe not with like your husband's razor in the shower.
No, no.
One of my nurses was raving about it, and I said, "Well, I don't really have facial hair." And she's like, "Oh, but you do. You think you don't. Everyone does." But I like that idea because I use my tretinoin pretty much to the point of peeling, and so I could see that being helpful to just remove that top layer of skin. But the thing with younger patients is that their skin, their cell turnover in general is pretty good, right? It's as we age that it starts to slow down. So that's where I think doing those more exfoliants and heals and stuff like that become more helpful as well.
Well, and as we know, just because you're 30 or 40 doesn't mean you're going to stop breaking out. Sometimes we continue breaking out into our 60s. So it also helps with the acne.
That's true. Good point. So around 40s, like where I am, 44, right? The first peak, what needs to change or does anything need to change?
Well, I guess in that study, the microbiome changed a lot. And then their immune system didn't fight things off as well. So, I mean, I guess, your diet is important. Maybe you could start taking a probiotic, but I'm not really sure what it was that made it so drastically different then. But I think it was just the body's ability to fight things off. And
We feel that too. I mean, my friends will come to me. We feel like we can't just bounce back like we used to. But I love that you brought up some more like holistic ways to think about aging gracefully, right? I think a lot of times people think about aging and they want to know what procedure do I need or what cream do I need to put on my skin. But really, I think for really the most impactful aging and health span is to really take care of your body, right? And diet and exercise, stuff like that. So can you just touch on that a little bit?
well, definitely the Mediterranean diet has been shown probably to be the healthiest and the best way to eat healthfully and maintain that those blue zones. They all have the kind of the Mediterranean diet incorporated into their life. Also, there's something called AGEs, aminoglycoside end products, and they're basically like sugars. And we have these things called telomeres in our body. And unfortunately, you're genetically sort of born with your size of telomere. But as you age, and if you go in the sun or if you eat crappy fried food, all these things, these sugars stick on there and they break down and they get smaller and tinier. And then you can get cancers and all kinds of problems that happen as you age. So I do think there's a lot with the diet that adds to aging, and those things are called ages. They're in fried foods, and people think meat is bad, but I mean, meat is bad because we fry it or we grill it. But I mean, really, sous vide is probably the way to go. Fish, just Mediterranean diet, I think, has been proven.
And kind of plant forward, right? Like where the things you're eating resemble where they came from. You don't have to open up a package to get it, focusing on sugar, right? Like that was, I mean, I really never really focused on sugar before. I always just looked at calories and fat. And now I'm much more cognizant of the sugar count in things that I eat. And it's really astounding. Even stuff you don't think should have sugar in it does, which is crazy. Or like your Starbucks drink or whatever you're having, you probably would be shocked to actually look at how much you're eating. And the sugars can really cause premature aging. So that's something that I was kind of a wake up call for me in the last couple of years.
And alcohol, unfortunately. It's fun to drink, but it does cause
I know, even red wine, right?
it does cause ages, yes.
Really things in moderation, right? I mean, I still want to enjoy life. Like if I have to be so restrictive on everything just to stay young looking, then it's not worth it, right? I just want to not worry about it. But
I heard a quote somewhere, "I don't wanna stop living just to live longer." So that's kinda true.
yes, you have to enjoy life too. So, but these are all just things to think about because how you take care of your body, our skin reflects that, right? That's the cool thing about dermatology is we can a lot of times see what's going on internally with the body based on some of the skin findings that we see. So, and I think also for women in your 40s, right? You're most likely perimenopausal, maybe for some even menopausal. And now is the time, to get your body in like top shape, get your weight to as close to your ideal body weight, exercise, which really is more like resistance or weight training at this stage of life rather than cardio, like building that muscle of your bones. Because if you wait to do it when you're postmenopausal, it's just, again, it's way harder to play catch up.
Exactly. You're a ballerina, so you've always been in good shape.
Well, I say 20 pounds and 20 years ago.
Once a ballerina, always a ballerina.
Oh, that's right. That's right. So, okay, what about then menopause, right? Like a lot of things seem to change, not just with our skin, but how you feel, your ability to think. Just a lot of stuff is going on. Does skincare need to change?
I think this is where estrogen maybe plays a part. It's not necessarily skincare. I mean, I guess people could rub estrogen on their face, but I mean, I think if you don't have a contraindication as far as your family history or personal breast cancer history, I do think estrogen and progesterone, if you still have a uterus, play a big part in the skin aging and keeping it, the elastin and collagen from completely taking a nosedive. So I think it's a good idea in the late 40s to discuss it with your gynecologist. And the studies keep waxing and waning. It's good for Alzheimer's. It's not good for Alzheimer's. It's bad for this. It's good. I think the jury's out. But I do know skin research, estrogen definitely builds collagen, and lack of estrogen, collagen depletion. And unfortunately, we stop making as much collagen at about 25 and we just keep eating more of our own collagen. So it's like a battle that really gets bad around 50. So I think if you can be on estrogen supplements and progesterone if you need it, I think it's a great preventative measure in the 40s, 50s. The gynecologists are like at 65, we'll rediscuss. Again, some of my patients that are 80, they never stopped their estrogen and their skin looks great.
I do feel like in the next 5, 10 years, we're going to see a lot more studies on this. I feel like this has been a forgotten group of people for decades. And now there's some interest in it and sort of this public demand that women in this stage of life are not forgotten. So I think we'll be seeing a lot more of that. And yeah, talk with your gynecologist if they're not familiar with hormone replacement therapy, find someone who is, because a lot of GYNs didn't get a lot of training in their residencies, which is kind of surprising. But I also joke I'm in my college and banking era. So I find, again, like banking as much collagen as I can, knowing what's going to happen like postmenopausal. So I'm a big fan of biostimulants, things like Sculptra and Radiesse. I really like those. They have good data to show that collagen is built by doing those. Do you have any other favorites that you like for collagen boosting?
I'm into the lasers. I think they definitely have shown that they upregulate the messenger RNA that is young messenger, at least for 6 months after. And they also prevent skin cancer. So I'm definitely a laser proponent, even if it's like a little baby laser.
So when you say laser, are you talking about an ablative laser, a non-ablative laser, like a BBL, IPL, or can they all do it?
They all can do it. They all can do it. I mean, especially if you have a little rosacea pigment, I usually start with like a non-ablative, like an IPL or BBL. You can move on to something like a 1927, which is like, I call it semi-ablative, even though it's not supposed to be ablative. And then you can move on to things that are more ablative as you age, kind of do the hierarchy. And I do think peels make your skin look good. I just don't know if the data's there as far as getting into that mid-dermal layer, because I don't know if everyone knows it's not the deep area, it's that mid-dermis where all your collagen is made. And that's where these lasers, even if they're non-ablative, they're hitting that area and they're changing it somehow. They're changing your RNA and making it better and more resilient and maybe younger.
I also think looking more youthful involves more uniform, even complexion, right? To me, that's a big part of aging gracefully. My goal isn't necessarily to make sure I have zero wrinkles at all. It's more that I have an even complexion, that my skin looks bright and vibrant, it heals well. So, again, these lasers can also do a beautiful job with that as well.
Exactly.
What about collagen supplements? Are you a fan of those? Do they work?
I don't know how much you actually absorb. I mean, the jury's still kind of up in the air, but it can't hurt. That's why I'm not necessarily into a vegan diet for people, because you do need some protein, and maybe the animal protein has a part of our existence that we need, even if it's fish. Or that's why I think even the Mediterranean diet, which includes fish and some proteins, is better than a vegan diet.
I dabbled in veganism for a time and then was a vegetarian. And it was only in January of 2024 that I started eating meat. And I just felt my body kept craving protein. And what I was doing is just eating carbs to satisfy my hunger when really I just needed a lean piece of grilled chicken breast or some sort of animal protein. I finally, after 27 years, realized I really do need to incorporate more protein. And for me, that was starting to eat animal meat again.
Right. And then most of the time when people are asking about collagen, I mean, most of it out there is from either beef or fish, or so it's kind of hard to supplement. The people who would need it would be vegans or vegetarians, but they're not going to take it because it's made from animal products, most of it.
Plant one is not true collagen either. But yeah, I'm kind of with you. I did try, I think it was the Vital Protein from Costco for a couple months. And I can't really say I noticed a difference. I just put a scoop in my coffee, but it also had probiotics in it. So again, I thought, well, it can't hurt, right, to be doing this. So I gave it a try. I don't know if I'll go back to it or not. But yeah, I mean, there are people who swear by it.
I don't have any paid thing, but I just take Nutrafol because it has the fish collagen, fish scale collagen. So it has other things in it too, but it's kind of like, there's my collagen, my fish scale collagen.
What about LED masks? Like, I feel like these at-home devices are all the rage. Do you find that LED therapy, red light, that can be helpful for collagen?
I do. I think it takes a village. The more you can do, the better results. I think they're not gonna be as strong as like an in-office laser procedure or something, but to keep things going, I think it's great.
You just have to be consistent, right? Just like with using a vitamin A, you have to do it every day for about 10 minutes. But some of my friends who do it are like, well, this is when I journal in the morning or I meditate, and they just put it on. And so that's genius. I struggle to remember to floss. So for me, it's not as easy.
Flossing's important. The bad teeth have all kinds of problems.
I'm reformed. I do it, but I know my limit. I haven't gotten into that just yet. Well, I would love to know. So you're about to be 60. So are there anything that you are going to be looking to do in this decade or any changes with your skincare?
Well, I just purchased for my office a new laser that is ablative. So that means it takes layers off. It's a little more intense than some of the ones that I've done one of those, and I am going to continue to do those through my 60s because I think I just need more than my little baby lasers.
Is there a lot of downtime with those, or were you able to work?
Some of the traditional ones like CO2, everyone kind of, I always joke around like people will do CO2 once, they'll never do it again. Um, or I have another one called Erbium. They, especially in Florida where I live, it's just too much downtime. And I really want people to be out of the sun for like 12 weeks when they do those. And there's just no good time. Like up north, people could do that, during the winter. But in Florida and even Georgia, it's pretty sunny year round. So this new one, you're pretty much healed in 5 or 6 days. And that's really what my patients want. They just want to be living their life. They don't want to be hiding out for 12 weeks or something. I guess unless they're having a facelift, then they can do it then, but
It's true. It's like they want the big impact, right? But it's hard to get people with our busy lives and everything to commit to 7 days, 10 days of downtime. And I get it because I look at my schedule. I had foot surgery and I'm like, oh, there's no good time to be stuck in a boot, right? Or hiding out at home with our lives the way they are. I would say the best time probably though is January because the holidays are over and people are kind of like over socializing. So I kind of joke that that's the best time to do it. But yeah, in Florida, it's tough because it's sunny year round.
I mean, the one great one that can, that collagen banking and it has no downtime pretty much is either all therapy or soft wave. Those are kind of lasers, they're ultrasound, but they're going deep to the muscle, the SMAS muscle, which is what you lift when you have a facelift. And they're creating all that type 1 and type 3 collagen and really no downtime. So that's a great one too. But I'd say that's better to start in your 40s and 50s. Don't wait till you're 60.
I know a lot of times patients will come to me and they really need just surgery, right? Like there's a limit to what these devices that are out there are amazing. But again, if you come in and you're pulling your jaw back, Ulthera and Thermage or whatever laser is, it can only do so much, right? And there comes a point where surgery really is the best option because you'll end up spending a lot of money and just not getting the results you want.
But even if you have surgery, you still need to do things. I've kind of been assessing it over the years, and I feel like even the best facelift only lasts about 7 years.
Even, removing that skin, making it tighter, like your skin integrity still needs to be good, right? Like you still need to have supple collagen. Your skin, the whole canvas needs to be even and uniform because that facelift, that neck lift, it's not going to look good if the canvas doesn't look good. So it really is just coming at it from multiple different approaches.
A friend of mine who's a facial plastic surgeon, he's like, when people have all therapy, their skin is so hard to like undermine and pull up. And I'm like, but isn't that a good thing? Because they have more collagen. So your facelift's going to work better, I feel like. So,
Right. And maybe it can kind of stave off. And possibly by doing that, maybe you've pushed out your facelift to every 10 years or getting the first one later in life and not starting so early.
that is kind of what I tell people, when they're in their late 50s, early 60s. I just am like, are you going to have a facelift anytime in the next 2 years? Because if they are, I'm not going to have them waste their money on a very expensive thing like an all therapy or the full ablative, ultra clear, but if they say no, then, and I've done that for people and it's 15 years later and they're 75 and they're like, I'm never having a facelift. All right, we got you through the hump. And you could tell your husband, I saved you 2 facelifts.
There you go. So really you're saving money, right? I guess that's called derm math, right?
Exactly.
What are your thoughts on exosomes? I feel like I'm hearing a lot about that, and I've actually have started using some exosome serum, and I'm loving it. So, do you have any experience with that?
Well, my only issue is they're not, except the plated. The plated is a topical that comes from 20 to 40-year-old platelets from blood banks, and that it's not human derived. It's the little cell. It's like a cell that tells your skin or other parts of your body what to do. So it's not the actual human tissue. So, and that's through Mayo Clinic, and I have been using that a lot. I haven't been ordering any of the others because I just don't know where they're coming from. And it's placenta or, I just don't know the quality of it or what the screening, and they can say they're good. It's kind of like the wild, wild west out there. And I don't really want to be injecting or putting things on people that I don't really know where exactly it's coming from.
I'm with you, and I use Plated. I pay for it. I'm not endorsed by Plated, but I have been really impressed with it. And I find that the science is really there. But with a lot of these regenerative procedures, like people saying they're going to do stem cell infusions and inject exosomes, like you have no idea what they're actually injecting or what it is. So I would say just with caution, I'm optimistic about where this is going, but there's a lot of snake oil out there. And in fact, I had a patient today who was coming back for her post-op, and she said that 2 days after surgery, her primary care doctor injected her with exosomes. And I was like, "Well, what kind of exosomes, and where did he get them?" And she had no idea. And I didn't say this, but I'm thinking, like, there are no, approved exosomes for injection in the US, so I have no idea what she got. So anyways, you just have to be careful with that.
Yeah, I mean, and I was using a lot of PRP on people, their own blood. But, the reality is when you're 60 or 70, even if you are the best 60 or 70, your PRP isn't as good as it was when you were 20 or 30. But I do tell people if they're going to do something with PRP, like either with microneedling or use it after a laser, I do suggest that you could get it online eating like a PRP diet for a week before. No nonsteroidals, no alcohol, a lot of leafy greens and beans that you could kind of see what makes your PRP better. I guess we should all be on that diet all the time, but
I know, right? Well, I guess that would also be no aspirin, right?
yeah.
It's not a coincidence, right, that one of these exosome companies only uses blood from 20 to 40-year-olds, right? They want that more youthful platelet, which, you just don't have as you get older. So I think it's an exciting area. I think really that's where sort of medicine and aesthetics is heading, trying to sort of help get rid of these senescent cells that are driving these sort of negative things within our body. And so definitely more to come on that. And yeah, just sort of buyer beware at this point, but something I'm excited about. Well, Dr. Flanagan, this has been a lot of fun. I've learned a ton. I'm not so scared about my peak at 60. I'm going to come down and see you for some treatments,
Okay, sounds good.
try out your Ultra Clear. Can you just leave our listeners with like your top 3 tips for aging gracefully?
Number 1 is definitely sunblock. Gotta use it every day, and try to seek the shade and wear sun protective clothing because it's just photo aging, you see it. I mean, it's the number 1 cause for skin aging. And Retin-A is a favorite, or retinol, or even the low level. I think that's great. And I'd probably say I'm not really sure, and I think doing these little baby lasers along the way are really good.
I would just add, like, see a dermatologist too. They're not just going to be like one treatment here, here. They kind of create like a plan for you and can sort of see like the follow you long term. I think too often people think, oh, I just need this one procedure, this one device. But really, I think more beneficial is having a relationship with your dermatologist who can really help guide you over the different seasons of your life.
And they can do a body check and make sure you don't have a melanoma or another skin cancer, so
For sure. I mean, I've seriously seen so many melanomas that were lasered off. by non-dermatologists because they thought, "Oh, get rid of this brown spot," right? And it's really scary. So, yeah, I would just say add that one in for you as well. Well, Dr. Flanagan, where can people find you, follow you, or come see you? Can you tell us all that info?
Well, I'm not really so big on social media, but I guess we do have a Instagram page, Genesis Derm.
Yeah. Okay. At Genesis Derm. Well, I will include that in the show notes. And if you're in the Jupiter area or surrounding areas, definitely go see Dr. Flanagan.
That's right.
Well, thanks so much. And I'll see everyone next week.